So this is a lumbar vertebrae, but I want to use this particular vertebrae as an example to tell you about all the different parts that most vertebrae have, because they're pretty exaggerated here. Now the lumbar vertebrae, they're carrying the most weight, so they're going to be a little bit bigger. So it may be a little bit bigger, a little bit smaller, depending on which of the types that you're looking at. But as a general rule, almost all vertebrae have an anteriorly facing body, and this is the weight-bearing part. So there would be little pads called the intervertebral discs in between adjacent vertebrae that help relieve some of the stress and prevent bone-on-bone from happening. The body is always anterior. Posteriorly on almost all vertebrae is a pointed process known as the spinous process. If you've ever run your finger down somebody's spine or your own spine and it felt bumpy, you were touching these as your finger went down. Laterally on the left and right side, you have a transverse process because it's in the transverse plane and they point side to side. So left and right transverse processes. In the middle, you have an opening called the intervertebral foramen, and if you stack vertebrae on top of each other, these become the vertebral canal when they are collective. Now I'm going to pick this up and turn it where you can kind of see a little bit different perspective. So here's our body, here's our spinous process and transverse processes on each side. So in order to make the intervertebral foramen complete, make it a circle, we have to have some little bony connectors. So connecting the body to the transverse processes, you have a little wall here on the left and right side called a pedicle. Connecting the transverse processes to the spinous processes, you have a little roof here called a lamina. So if you look at it, it sort of looks like a little house. The walls are the pedicles and the roof is the lamina. So spinous process, lamina, transverse process, pedicle, body, intervertebral foramen. Now importantly, the vertebrae interact with each other. So there are many joints formed between the vertebrae. So they have to articulate or touch the vertebrae above it. So you have a superior articular process on each vertebrae that sticks up and an inferior articular process that points down. So superior articular process, inferior articular process, and these stick off of the lamina. So superior articular process, inferior articular process. And you can see them there coming off of the lamina.